water treatment plan evaluation. That's something obviously we'd like to get an update on what's going on with that. We know they had plans for that. The plans for that have gotten complicated. And so when he comes, I'd like him to give us, just let us know what's going on with that. Then the next one is the phase one. I guess they're doing that. The phase one is the sewering of Town Neck and downtown. And they're just reviewing the scope of the work for the hydrogeologic study. And then the last thing is the Mashpee cluster septic system, and that's going forward. And that, I guess, since it's given the size of that, that's all going to be under the authority of the Massachusetts Department of Environmental Protection. As he said, Town of Sandwich review of approval is not required. And the Town of Sandwich will just be monitoring what's going on. He did touch on that, I guess, there's been some discussion from the Sandwich about maybe the town of Sandwich participating in the cluster system. So I'd like to get more information if anything like that might be happening. So that's all I had. I don't know. I mean, if that's, we can leave it at that. If there's concerns about saying anything else. I thought that was a pretty straightforward thing, but okay.
This is the situation where the people who live in Mashpee are.
Yeah, well, they were, we've gotten concerns from the people at Mashpee about the water wells, but first of all, what's happened is Mashpee finally voted on it. They're going forward with it. The next step is they have to submit a hydrogeological study. They have to do the study. It has to be approved by the Department of Environmental Protection. So there's a lot of hoops they have to go through before this thing sees the light of day.
It'll be years, right?
But well, I don't know if it'll be years, but there's a lot that has to happen. And the Department of Environment, it's all going to be under the authority and regulation of the State Department of Environmental Protection. And obviously, they're very aware of anything regarding private wells, wetlands, and all that. All that is going to be clearly taken care of and be aware, and they'll be taking all that into consideration as they look at the plans that Mashpee is going to bring forward. So I understand the concerns the people had, but I think there's a lot of things that have to happen. And there are a lot of people that are going to be looking at that. Nothing I don't think is going to slip through the cracks on this whenever it gets put forward. So, all right, well, let's move on from that then. Okay. The next thing is, well, Ron, then, do you want to give us one through the information you provided us from the meeting of the opioid task force on November 1st, in terms of the decisions that were made? You can just run.
Sure, I a brief outline. It's pretty not controversial about what they decided to do with the money. You see treatment centers, the Next Chance program, the housing assistance, and the parent supporting parents. They're all active programs. The amounts of money, you can see that $15,000 for housing assistance is a pretty small amount of money. It'll probably be in the order of short-term, a rental for somebody to get past a crisis. There was a little controversy at the meeting, and because some folks thought that there wasn't enough money set aside for more of the acute treatment centers. That sober living centers have a poor record of keeping people from addicting, or whatever the word. And so so there was some controversy about this. So I don't think these numbers are final. Heather Harper said, listened. She was great. She listened to what the objections were, and she said, and there still was $25,000 left out that was not committed for. So I think she can look at it again, and we may meet again, or maybe she'll just
Successful suicides,
yeah.
or just attempts.
Yeah, so that's the majority of their calls now, mental health crisis in the home. In the whole gamut I just bring it as information to let you know that this is a serious crisis in mental health out there. I don't have any answers for that, but it's discouraging for the workers. I said to Josh Brown, I said, this is going to be brutal work. This is hard on the healthcare workers and the police. It's terrible. Trying to intervene with domestic violence, and alcoholism, and depression, and suicide ideation, and so forth. They weren't exactly trained for that. They went to the police academy. So anyway, a word of support to them. People working hard at this, and I think I was impressed with the efforts of the fire department and the police department and the social worker doing that.
So are you guys gonna meet again, or you have another meeting planned?
I think Heather Harper, I'm being blunt, was a little bit taken back by the objections to the priorities.
Oh, yeah. I thought you guys voted on it. I thought it was a vote.
It's not a vote. No, it wasn't a vote.
Oh.
No, it was I don't remember. Heather, we take a vote?
It was a smaller working group that came together for that.
Yeah, so I think my impression was Heather was going to take it back to the drawing board and think about it and see what there's just not enough money to spread around to do everything.
Is there a deadline for spending the money or something?
No.
No? Okay.
No. So
these amounts and even the specifics of what it's going to be spent on could change.
Yeah.
Yeah. Okay. All right. So it's kind of to be determined then.
Yeah. And I'll come back with anything.
Yeah, definitely.
Further updates of it, and maybe a little more detail about what the programs are.
Yeah. Okay. Great.
Just as an FYI, I volunteered for the Samaritans for several years, and Anybody can do that. It's a really small commitment too. They train you, it's like 4 hours a week. It's mostly listening to people. If you're ever inclined to want to be part of.
And that did come up, the Samaritan group, that they were gonna meet with them.
There's a group on the, I did work in the Boston office, but there's one on the Cape.
Yeah, there is.
They're pretty
Got a
nice.
sign going over the bridge.
Yeah, right. That's how most.
That's
people
right,
are.
yeah, cycle. Okay.
There's a lot of people who rely on those phone calls every day.
All right, okay, thanks, Ron. Health department updates, anything going on? We haven't gotten any, I guess, any, violations or any other issues that have come in from the, haven't
Everyone's
gotten any
behaving, okay.
notifications?
Nothing worth,
Yeah, okay.
you know, I don't wanna make that sound the wrong way, but, you know,
Yeah.
just business as usual, I mean,
Yeah.
doing things every day, but nothing feel we
And
need,
when
that
the
might come
windows
before you in the
close,
future.
they stop.
Say that
Yeah.
again?
When the windows
Yeah.
close, it stops.
Oftentimes.
When the windows
Right.
open,
Yeah,
they flood. And I've been there for 18 years and that's how it goes all the
really,
time.
yeah.
In the spring,
Right.
starts up. And
It's
then
all starts
you
up.
shut the windows and you don't hear anything. Everybody stays in their house.
But nothing we feel that might come in front of the board at a
Okay.
later date, which is what we like to bring to your attention, but
Alright.
yeah, business as usual, still issuing permits, still doing inspections, so, renewal period, so it's kind of a crazy time, but, for all the licenses, most of the licenses, so you have just, but nothing, unfortunately, you know, that we wanted to bring to your attention for future, perhaps, action, but nothing of that nature.
Okay,
I have
Alright.
a couple things I wanted to tell you guys.
yeah,
I have not done the annual meeting calendar as yet. I'll do it quickly and hopefully if we have a December meeting, I will bring it to you. If we don't have a December meeting, I'll distribute it. But we are gonna have to move location because they are planning on doing some work at the Old Town Hall, which is where the Historic District Committee meets now on Monday nights. And they get precedence here, I guess. So we're gonna meet at our building in the upper level conference room. So on the side of the building, easy peasy. I don't believe it will be filmed because we don't have CCAT set up there, at this point, so we'll be back to basics, but we're gonna start that in January. Even if they're not ready to start the project in January, I wanna set the calendar with this place.
yeah,
And it's gonna be really convenient for Heather and I, because like, we work right up to the minute we have to leave to come here.
so
For
you'll be
instance,
right there.
Yeah, I'll be right,
I always meet there then.
we'll be right there, yeah.
I think they used to.
Well, we used to
Years ago.
meet
I worked
at
in
Jan
Sebastian.
Sebastian Drive, yeah,
Yeah,
but it's fine, I just wanted to let you know that.
I'm bragging you over here.
And then licensing, I got the email out on October 31st, I think Halloween, so I was very happy to get all that out. Heather worked really hard on updating all the applications. So that's looking good, they're coming in slews. Next year, we're hoping, we didn't get it done this year, but next year, we're hoping to be online, which will make my life easier. So that's my goal. And then that was it. I wanted to tell you about the new spot, but you'll know, we're gonna stay here through for our next, well, it's only one more month.
yeah, there's one.
So, which I can't believe we're already at the end, but that's what's going on there, and, other than that, we're just busy doing the same thing we do every day.
Okay.
I lost another staff member,
Oh, no.
so now I'm back to having just one person. So it happened last year too in October when it's like big time for Board of Health, but here we go again. So I'm rolling with it, still smiling. So that's what's going on in our lives.
Okay, thank you. So the last agenda item then is we have a set of minutes from the August 11th meeting. Anyone have any comments on that? Michelle sent us the draft minutes. Do you
I
have?
must admit, I didn't. Is it in there somewhere?
I have a copy here.
It was on the email.
It was in the email.
I mean, it wasn't really too exciting.
Yes.
Yeah.
Maybe we can look on it.
I had- Oh, boy.
This process is unbelievable.
Yeah, you didn't, yeah, I don't know why you went through. It was back in August.
Can't remember.
Well, you weren't here, I don't think. Didn't
Yeah.
you say you're out?
I don't think I was here.
Oh, I think Ron was out.
Yeah.
Do you have them, Susan?
No, I read them online though. Oh, no, here, is it? No.
No.
No, Ron
You
was
can look
out.
at it.
Yeah, look at it, I got it right
Look
here.
right here.
I read it. Looks good. Good.
Okay. All righty. Do I hear a motion to approve the minutes as drafted for the August 11th meeting?
So moved.
Seconded?
Me, yes.
All in favor?
Aye.
Okay, and if there are any other issues or anything anyone can
Just
share?
the one last thing is that if I could suggest that we, if Dave can't come to the next meeting, that we would agree to meet him whenever he could.
Whenever you could, sure. Yeah.
So if he,
At his
if it's not a
convenience.
good, yeah.
Yeah.
And obviously making sure that we could get there. But
Yeah.
if
If we were to do that, I mean, how does that work? Is that an official Board of Health
It
meeting?
is.
Yeah,
It's
so
a
we-
public hearing. So when you three are in a room,
Yeah,
it's a, yeah, it's a.
so we'd convene a special meeting if that's
So we
what,
would
if that
put it on the
works
books.
with the
Yeah,
Dave.
we put it on the book, we post it, we make sure the room's available.
Yeah.
And then when we convene, it's public.
Okay,
So that's how we do it.
okay. And, yeah, I mean, if he can make it to a regular scheduled meeting.
Yeah,
that'd be
I'm gonna
great.
push for December.
It's
So
December 8th would be our
8th?
next scheduled meeting.
All right,
Okay,
and can I have an adjournment for 6:25?
yeah, do I hear a motion to adjourn the
Do
meeting?
you have something? I'm sorry.
motion to adjourn.
Seconded,
Second.
all in favor? Meeting's adjourned at 6:25.
Glad I wasn't too late. I'd have missed the whole thing.
Yeah,
Motion and who did that?
say that
You
again?
just don't miss the commute, Ron.
Ron?
Okay, perfect. And
Missed
Brian,
that
that's
confused.
Susan.
I don't have one.
You don't miss the commute.
Uh,
Oh my God. Did you work in Longwood from here?
oh, yeah.
Yeah.